Hello, my name is Nathan Salinas. I am an ear, nose, and throat and facial plastic surgeon. I'm excited to speak to you today about looking and feeling your best. When we think about aging, we really want to think about it as an experience that is something that shows we've had a full life. But what we want to do is we want to work on aging gracefully and using some of the tools and techniques that we have available to us to manage that process. So my philosophy with addressing aging and correcting the aging process is really to take a step back and make an individualized plan for patients that targets their specific goals and needs. Facial plastic surgery should be considered when there are changes from photo aging or just the general aging process and you're interested in facial rejuvenation. There may be some cosmetic concerns that you have regarding previous trauma or congenital changes that you've had since you were born. So it's really important to think not just about surgery as a fix for some of the aging issues or the process that happens with aging, but think about really lifestyle modifications, so good hydration, good rest and sleep and nutrition and appropriate supplementation, and avoidance of exposures, for instance, sun exposure, and protecting ourselves with appropriate skincare products. We think about neuromodulation, so things like Botox, which can help us with those dynamic lines and to prevent those formation of wrinkles. And so we want to think about those things early on in our lives to help with prevention and kind of to slow the aging process. We now have some exciting therapies available for patients that address in very specific ways, for instance, some of the collagen and elastin changes that happen with aging. This includes the radiofrequency ablation therapy that we have now available. We also have the ability to treat some of the deterioration that affects the skin, those pigment changes and texture changes that affect the skin in time. And that includes our CO2 laser ablation technology. And then we have surgical interventions, which are helpful to address many of those things, for instance, when they have crossed the boundary of being amenable to less invasive options. And these include things like a brow lift or an eyelid lift or a blepharoplasty, facelift or neck lift or rhinoplasty, or even an ear tuck, for instance, with an otoplasty. But there are some significant functional issues that can occur and be addressed with facial plastic surgery. For instance, if our brow is ptotic or descending, kind of saggy, if the eyelids are drooping over the actual eye itself, we can have vision changes and vision loss. And so facial plastic surgery can address those, not only leading to a more rested and vibrant appearance, but help individuals with their eyesight, for instance. If the nasal passageways and the nose tip has become softer and less open, then nasal surgery can also be helpful for these things. If there's been trauma to the face affecting areas of both cosmetic or functional concern, those can be addressed with facial plastic surgery as well. You should choose your facial plastic surgeon very carefully. It is important to think about that individual's training and experience, as well as philosophy on managing facial concerns. And so it's really important to think about picking your facial plastic surgeon as somebody who is able to address those both functional as well as cosmetic concerns. If you have concerns about facial cosmetic or reconstructive issues, whether they be minor or more major concerns, please contact us through the Women's Specialty Care Clinic.